Do I get you?
Yeah, I'll get you.
Hello everyone, and thank you for coming today. I'm Christina, and I'm the Conservative candidate for Kelowna Centre. I'd like to welcome my colleague joining me today, Macklin McCall from West Kelowna Peachland. It's my great pleasure today to stand before you and introduce to you a man who's been fighting for British Columbians for over 2 decades. John Rustad is the leader of the Conservative Party of British Columbia and the person who has given the people of our province hope after the radical ideology of the NDP has put drugs on our streets, crippled our economy, and caused our cost of living to skyrocket. In Kelowna Centre, we are grappling with the effects of addiction in our city, near our businesses, and the addition of new supportive housing developments in our neighborhoods. We want real solutions for crime, public safety, housing, and especially for our loved ones who are in need of treatment. I'm thrilled to be part of the team helping John with this fight, and I know all of you are on our side. So without further ado, please help me welcome the man who has brought hope back to British Columbia and our next Premier, John Rustad.
Well, thanks very much, and it's a pleasure to be in Kelowna. So much positive. I always love getting an opportunity to be down here in this area. My wife and I enjoy coming down at least a couple times a year, visiting with friends. But there is certainly some issues that need to be addressed. And when we're looking at what's going on, for example, behind us, I think government needs to step up and do a lot more. And I know the City of Kelowna is doing the best they can. When you look behind me at the facilities here, they've provided porta potties, they've provided some trash cans and some wash facilities, they're out providing some food, and that's much needed. And I know that the city's trying to do everything it can for these people, but I think as government, like I say, we need to do more. Across the province, when we look at these situations, the tent cities that we've seen crop up, often we are seeing crime, not just within tent cities, but beyond, within the neighborhood, within the area. Drugs are commonplace throughout this, and occasionally we also have situations of violence. And in my opinion, this is the part of the problem. This is what needs to change. This is what needs to come to an end in British Columbia. And so part of this is we need to make sure we've got a clear path towards addressing this and cleaning up our streets. As the Conservative Party of British Columbia, we also recognize that it's not just about people who are homeless or people who are addicted or people with mental health. There's a combination of things that are happening. We need to do what we can for each of those groups. It's not a one-size-fits-all in order to being able to solve these things. But we're committed to bringing an end to having tent cities in this province. It is not the way that I think anybody would like to see their loved ones or people be able to live. It's certainly not what we want to see happening within communities because of the issues and things that can come up and happen as part of this. And so that also means, though, as part of that, we need to make sure that we have options. Where we have people with addictions, we need to make sure that we provide the opportunity for people to get clean through detox, and then to have the opportunity for supportive housing that is drug-free. And that's a key, in my opinion, is these facilities that we build need to be drug-free and a zero tolerance for drugs as well as for crime. We need to make sure that as we build these, as we put housing in and available, that they're in appropriate places within communities. We need to make sure we're engaging with community members, getting feedback, making sure that they understand exactly what we're doing, making sure that we have the support in place, because of course getting off the addiction in terms of the immediate addiction is only one thing. Being able to carry on with that, being able to move forward in a supportive way is a key piece. We need to make sure the services are there as part of having people being able to live in those facilities. It also means that for some people, we need to be looking at additional action taken by government and what we call compassionate involuntary care. And that is, of course, in the situation where you have a youth, somebody who is addicted, who refuses to go into treatment, say an 11-year-old girl, where parents would like to do everything they can to be able to help deal with that and give that youth the chance to be able to recover and to be able to get on with their life, we want to make sure that's available as an option in British Columbia. It's currently not an option, but we're also looking at more than just that, where you have situations where people have addictions and they are in that situation of severe addiction, not able to make good decisions for themselves. We are going to be looking at helping to build out some facilities that make sure that they can receive treatment as well, and as part of that, involuntary compassionate care. We'll need to build out some other facilities. For example, we need to be able to have low security units. The option for being able to have people into these facilities who can receive those treatments on an ongoing basis and make sure that they receive that proper care in a safe environment. One of the challenges I think we have with our healthcare system is they're overwhelmed by what's going on with addictions. So part of that is going to be, we're going to create crisis response and stabilization units. These units will be able to go in and provide targeted care for those experiencing severe addictions or mental health crisis. And by doing this, we'll reduce the pressure that we have on our emergency rooms and make sure people can get the treatment that they need. But a key piece of all this is to make sure that we enforce law and order in our society. The Conservative Party will ensure that there's strict enforcement of public safety laws to clear both illegal encampments and to keep public spaces safe. It is time we have the places for people to be able to go in our communities where they can feel safe, where law enforcement will be given the tools needed to be able to make sure these encampments are removed and that order is restored and people can feel safe. Big piece of this is rejecting what David Eby has done in our society. We will be stopping David Eby's approach of handing out free drugs and crack pipes in British Columbia. These are arguably these policies are helping to fuel these addictions and making the situation far worse. When you look, for example, in Quebec, even though they got twice the population of British Columbia, we have had twice as many people who have died from addictions in here, or not twice as many, but we've had more people who have died from addictions here in British Columbia. So this needs to come to an end. It's been a complete disaster. We need to make sure that the public's interests are taken care of, that we restore public spaces for our communities to enjoy, for kids to be able to go out and play safely, whether that's our parks or streets, neighborhoods. They should be able to belong to families. We need to make sure we're looking after their rights. And I'll just give you an example. And down in Vancouver, with one of the parks that was taken over and became an encampment for many months, if not even longer than that, all the apartment buildings around there, that was the playground for kids. They don't have backyards to go and play in. They don't have safe place to go. That was their place, and it was taken away because it was now become an unsafe place for children to be able to go and play. And I think that's wrong. As our society has been set up, we have these safe places that are there and available for children, and we need to make sure that continues to be available. So all part of this is having a fresh start in British Columbia, just bringing back common sense to this province in our approach in terms of how we address many of these things, making sure that we address the rights of all people in this province, making sure, quite frankly, that we find those paths that are desperately needed for people with addictions to be able to not only get housed, but to get the treatment they need so that they can restore and be on a path to recovery, I should say, in this province. So with that, I'm happy to take any questions that you may have.
Thank you. And just a reminder, if you're in call-in, to press *1 if you want to be in the queue. We're going to start with live questions. Wolf with Black Press.
Good afternoon, John. How are you?
Good. Nice to see you out of Victoria.
Yeah, indeed. Nice to see you here as well. The question regarding these homeless camps. You talked about legal and illegal homeless camps. The laws currently allow for homeless camps under certain conditions. How do you plan to sort of overcome the immediate issues regarding charter challenges and so on?
So I think as we look at this in terms of what needs to be done, I know there is going to be some challenges around this. We will be introducing laws to make it clear in British Columbia how we can address this, how we can make sure that we deal with the homeless issue and these homeless encampments. There are places, of course, that are outside of provincial jurisdiction, and for some of those places, obviously, those will be a challenge to be able to deal with. But anything that was within our jurisdiction, we're going to make sure we put laws in place that make sense. But a big part of that is also to make sure that we have both detox and treatment to be able to go into supportive housing as well.
And John, if you could also sort of talk a little bit more broadly about the Okanagan as part of your party's electoral strategy. So this region has a lot of independents. For example, you were up in Vernon earlier this morning. Kevin Acton is a strong independent there. How do you sort of see the independents fit in into the local races here? And do you foresee a possibility that some of the independents might take away seats that could be favoring you? The NDP obviously has a couple of seats up here. How do you sort of see the Okanagan play out? Thank you.
So Okanagan, of course, is an important part of this election, as all regions of the province are as we go forward. We're going to be campaigning hard through here. Part of why Kevin Falcon and the BC United Party decided to fold and not run candidates and come in and support who we are as the Conservative Party of British Columbia was because they did not want to see the vote split. They know as well as we do that the very destructive policies we've seen under David Eby have caused chaos. They've destroyed our economy and they're destroying lives, and they want to bring that to an end as we do. And so that's why they came in and supported us. It's unfortunate some of the independents don't share those views. They've got other particular agendas, but I think the people in this province are looking for the same sort of change, the common sense change that we are, and I'm confident that they'll make the right choice in terms of bringing an end to David Eby and these very ideologically driven policies and approaches in British Columbia.
Nick with Castanet, one question, one follow-up.
Hi, Mr. Rustad.
Hi, Nick.
We've had a number of supportive housing developments go up in Kelowna over the past number of years, including 2 transitional housing developments just nearby here to try to get people out of their tents here in Tent City. What will it take for you to end this tent city here? How many developments are you planning to build to make people not be required to sleep in tents? And if you were to end the tent city here, where will these people sleep?
Yeah, so that's obviously a critical piece of this, and I've talked with the mayor about what's going on in the community and the steps that they've tried to do to help people to be able to connect them with housing and with whether it's shelters and then moving beyond that into housing. So obviously there is more facilities that are need to be built out in terms of this, but a key piece here is we need to end the free drugs, the addictions. We need to get people into recovery. We need to make sure that as we build out these facilities that there is zero tolerance. I know in many communities there's a lot of pushback in terms of having facilities put into their communities because they're very concerned about the drugs and about crime that has come. We've seen in too many communities in too many areas around this province that have these facilities, which is why we've got to make sure there's a zero tolerance for these things as we build them out. But it's going to take some time to be able to do that, but it's a major step to be able to say we are going to bring this to an end, and we're going to treat it like the crisis it is and deal with it.
These people behind you, some of them are some of the most vulnerable people in our community here. Have you been able to speak with anybody who's behind you here about how they've gotten into the situation?
I haven't spoken with anybody, of course, that is here at the moment. I have spoken with many people who actually, just recently have lived in tents, have lived on the streets, and have been in the process of recovery and are still recovering. They've been, whether it's a couple of years, whether it's 10 years. For example, we've got 2 candidates who are running for us who are recovering addicts. And they have, lived on the streets. They've gone through that. So I'm drawing on those sort of knowledge in terms of it to try to create the path going forward. There are many people that are in various forms of crisis. It's not a one-size-fits-all. There's a wide range of issues that stem from, some mental health, some addictions, some people that are just, down to their luck and just can't afford things and that need that support and help. So we're going to make sure that it's not a one-size-fits-all, but we're able to try to connect people with the help that they need to get into facilities and to get through into housing and to make sure that they can try to re-engage and live productive lives here in British Columbia.
Thank you.
Corvin with Kelowna Now.
Hi, John.
Hey, Corbin.
Could you tell us exactly what happened when you suffered heart problems after your second COVID shot? Did
Sure.
you have to go to the ER, or what did doctors say?
Yeah, so I didn't go to the ER. So I was in the process of doing a little bit of work in my yard, moving some things around. I was using a wheelbarrow. It wasn't very stressful. And I just suddenly felt very weak and just, just not having energy. It was really quite phenomenal. I've never felt that kind of experience before. I should have gone into emergency. When I talked to the doctor, he said you should have gone into emergency. I decided to lay down. It took a couple hours for it to pass. I did go in and see a doctor in terms of a follow-up. They did put on a monitor and checked through. I did some scans in terms of there wasn't any damage done to my heart through that. But clearly there was an episode there, and That was, like I say, 6 weeks after taking a second shot of the COVID vaccine.
Thank you.
Okay, we were going to dial in. Paul Johnson with Global.
Good afternoon, and thank you for taking my question.
Hi, Paul.
Hi. We went out yesterday to Abbotsford. There is a long-term care facility out there called Maplewood. And currently, Maplewood has 11 empty beds that are clean and ready to go and to accept some of the British Columbians who are on waiting lists for long-term care. However, those beds are not available because of kind of a mysterious snafu, a bureaucratic problem that's going on between the long-term care facility, the group of doctors who refer there, and Fraser Health. We talked to Fraser Health about it, and they said they acknowledged the problem, and but they weren't telling us that they were going to immediately jump in and solve the problem. So 2 questions for you, Mr. Rustad. One, your reaction to the situation of 11 empty beds in long-term care out there in Abbotsford that can't be filled for some apparent reason. And 2, can you tell me more about your vision if you formed the next government? What would you do to expedite cases where there is not a medical barrier to getting care, but merely a bureaucratic one?
Yes. So thank you for that. And the situation that I look at across the province, and I don't know specifically about this case, but I think it's somewhere around 20% of the beds, more or less, in our hospitals today are taken up with patients that are looking for long-term care or that need long-term care. And so this is why we have a commitment to be able to actually build out additional facilities and space that's needed. We want to be able to connect people. And in that particular case, I do look at the whole situation from that situation of bureaucracy. Bureaucracy should not be the reason why something is not getting done. People need services. They need to be able to get connected to them. I look at, as I mentioned before in our health reforms, Germany, which has twice the population of Canada, Canada has 10 times as many administrators in health. Close to 40% of our nurses today are administrators. We have to look at how we actually significantly reduce those administrative burdens and making sure that everything we are doing is focused on a patient, not on the system itself. And so I'm actually disturbed to hear that there's long-term care beds that are available that are not being used, and that is an administrative problem that is causing that. Certainly something that we need to look into, and as we put forward our changes that we need to healthcare, part of that is to remove all of those restrictions and administrative, I guess you could say, bureaucracy that is preventing us from being able to make sure that we're focused on patients.
Was there a follow-up there, Paul?
I think he put a 2 into 1. I don't know if you want to have another one.
Okay.
Okay, thanks, Paul.
Maurice Katz with CBC.
Hi, Mr. Rustad. Thank you for taking my question. Earlier today, David Eby, in a press conference in Vernon, mentioned that he's on the side of British Columbians and that you're on the same side as, quote, his billionaire speculator friends. Do you have a reaction to that?
Well, you know, David Eby says a lot of things, but all I can say is this. What we see today is people dying on the streets because of drugs, people dying on the streets because of crime. 1 in 2 youth thinking about leaving this province because of unaffordability. A complete collapse of housing, 30% reduction in housing starts. People can't find housings. We have our resource sector that is completely in disaster, with 2/3 of the forest sector, for example, being shut down. Our finances are in horrible shape. There's so much going on in this province, and David Eby says he's on your side. I tell you what, there's a lot of people in this province that would rather not have government, not have David Eby on your side because he's putting you into the ditch. We need a government that's just going to bring common sense back to British Columbia, and that's what the Conservative Party is focused on.
Thank you, Mr. Rustad. As a follow-up, he also mentioned that when you were asked about the speculative home tax, the empty home tax, that you don't know what you're going to do with it after you had opposed it for 18 months. Do you know what you're going to do with the speculative home tax?
From my perspective, we need to get government out of the way to unleash the private sector in terms of housing. David Eby believes that the private sector has no place in housing, and I'm sorry, but the vast majority of housing in this province has been built by the private sector. The private sector is being stymied, not being able to do this, which is why we've seen a 30% reduction in housing starts in British Columbia. We need to unleash that potential and make things happen. And then from there, once we're in a situation where we get our housing starts up, where people are being moved into homes, where we get our rental units built, we're going to look at all of these issues that David Eby has put into society. But I'll just maybe add one more thing. David Eby first started off saying it's foreigners, and then it's speculators, and then it was vacant properties, and then it was Airbnbs. The reality is the failure that we have in housing is David Eby and his policies that are not allowing housing to be built in this province, and that's what we're going to fix.
Last two questions from Mark Page with BC Today.
Hi, thank you for taking my question, John. Speaking to, some outreach workers around Victoria, one of the difficulties is with encampments is there's always some people who don't necessarily want to move into supportive housing and treatment centers and things like that. What would happen to the people that simply don't want to move out of these encampments?
No, you're absolutely right. That is a challenge. And there are people, for example, who have had, and unfortunately to say this, permanent brain damage from these drugs that are on the street, that are not in a situation to ever be able to fully be able to go back into society, that are living on the streets. They are in a place where they can't handle the idea of being in four walls in terms of room or any sort of housing. So we need to be creative in looking at other options that are available. It's also one of the reasons why we need to also be looking at long-term care and treatment for people, which is why we're going to look at reopening Riverside, making it a center of excellence in terms of long-term care that's needed for people who have these problems and have these sort of issues. So there's going to be a range of things that we're going to need to look at. And for some people, they don't fit into any of these categories. We're also going to have to find out how can we support them and how can we be creative. This is why I say it's not going to be a one-size-fits-all to solve all of these sort of issues, but it's a commitment that we do need to resolve, because I don't think as a society it's right for a government to say it's okay for people just to be living out on a street.
And then just to follow up, just in terms of addiction,
Riverview, sorry.
Sort of a similar question. Sorry, what's that?
Oh, I was just saying, I called it Riverside. I was just, one of the cameramen pointed it out. It's actually Riverview. My apologies.
Okay. Just a same question really on addiction. There's people who obviously they are not ready or not willing to stop using. And, you've obviously spoken a lot about how, youth, say someone who's 11 years old or 12 years old, their parents should be able to put them into involuntary care. But what happens to those adults who are in a situation where they don't want to stop using? What's the line of putting somebody who's an adult into involuntary care? If they're using, if they've got mental health issues, if they've got trauma issues, how are those decisions being made?
Yeah, thank you for that. And obviously we'll work with health professionals with regards to this. But from my perspective, where you have somebody, for example, who's OD'd and is brought back to life, clearly they are not in a situation making good decisions for themselves. And that's where I think the state needs to step in and be able to support and help people like that through treatment. There will be many situations where people are not in that situation but are still using drugs, that's their choice in terms of it going forward. However, where you end up with these severe cases of addiction, where there's significant risk of harm to themselves or others, that's where I think that state will need to be looking at bringing in that kind of treatment. However, I think my hope is those cases would be, rare and not something that would be a default. I do believe strongly that people have rights and we need to be able to protect that. But at the same time, we also want to make sure we're doing everything we can to end this absolute destruction of lives that we've seen with this overdose crisis. When I was up in Campbell River and saw that monument of 12,000 blue flags on the ground, one for every boy and man in British Columbia that has died of an overdose, and more being added every month, that's when I came to the decision that no, we need to be able to end this. And it means we're going to have to take some measures that to date have not been something that government has been willing to do.